Bhavani ma'am, please continue.
Yes, ma'am. Thank you so much. Am I audible?
Yes, ma'am, you are.
Okay, ma'am. Thank you so much. As I was saying, as a parent, it's been very challenging thing to handle a child with autism. But if the parents are going to focus on some positive things with their children, it will be much easier for them to handle uh, with the children who are being autistic. Actually, what I mean to say is, if you praise the child for the behavior, that means that you need to show a little bit of concern. Apart from that, the parent has to also show a lot of care and attention is being needed to the children. So for that purpose, we have to encourage the child for the little bit of good things which they do. That means that if at all the child is being progressive in some of the things, we need to encourage them, and we have to also speak to them in a very polite manner. For that, the parent has to have a lot of patience. That requires a lot of patience to handle such kind of autistic children. As of now, sir has already explained about this, that the children who are autistic, they are quite cranky, and also they behave in a very abnormal manner, just by throwing some of the things here and there and being so much stubborn about the behavior. So it's been very much problematic for the parents. And not only that, the parents also can find some ways, just by praising them, by giving some sort of small rewards, just by giving some small prizes in the form of a toy, or it might be some stickers or some of the things which they like mostly. As of my knowledge is concerned, most of the kids who are autistic, they will be liking only some sort of food. That means, for example, if a child is only liking the half boiled, for example, he will be consuming that food continuously for a longer period of time. And most of the autistic children, they won't even be able to accept some of the foods which are more spicy. So taking care of the food which they have been liking, that is also one of the major concerns. And as a parent, the parent has to take care, so that they need to love their child more and more, and by showing a lot of affection and love only, the parent will be able to handle the kid who is being autistic. And apart from that, they have to stay consistent on the schedule also. What I mean to say is that the parent has to make sure that they get consistent guidance and interaction from the parents. That means that you have to pay a lot of attention of how the child is being behaving as per the schedule. Means that means that at what time he or she, your child, at what time he's waking up, or the lunch schedule, everything has to be done as per the schedule, so that the child did not get cranky whenever he or she is not getting the same which they need. And apart from that, it's not always easier to handle the kid who is autistic, but you can take some help from the therapist, and also you can go for taking the help of the parent who is also facing with the same problem of autism. But there are many parents who are also facing the problem with the autistic children. So the parent can discuss with other parents what sort of things they are being following up for handling the child. So this can ease the parent to bring up the child who is autistic, and they can also develop or apply some knowledge in these situations, just by following the therapist or going for any other doctor or any other relatives and all. And not only this, the parents, apart from the support of the therapist, they also need a lot of love and support from other family members, and also the friends who are all around to them. And not only this, one of the best techniques a parent can do is taking your child outside frequently, so that, say for instance, if a parent is going somewhere outside to buy some groceries or something, if at all the parent is going outside, you need to take your children along with you, so that it will be a kind of a small exploration to them, so that they will be able to explore the outside world and get some knowledge how others are behaving, what sort of world is around them, so that it will be very much easier for them to grasp some knowledge, and also to gain some sort of change will be also helpful for them. And one of the most important things which I have also observed is about the parents who are breeding with the autistic children. they need to be they need to have a lot of patience. Apart from that, they should keep themselves from keeping they should keep themselves away from the stress, because as if they have to deal with a lot of things, so they have to keep themselves cool and calm. Why? Because as good things take more time. So if you are being patient towards your children, towards your work and every other thing, you will be giving a lot of more time to your child, and it will be very much helpful for the development of the child also. And not only this, there are some issues, just like if at all the child is not behaving in a proper manner because he is autistic, you can discuss with some other family members, or there's nothing to hide, because since it's a very natural problem, it can be caused to anyone. So you need to discuss all these things with the others, so that you will be able to get some proper knowledge about it. And as I said, in order to take care of your child, the parents have to cut a lot of stress from their life, so that it will be fine for them to take care of them. And apart from that, they will be also be able to take care of the child properly. That's it. I would like to say thank you so much, ma'am, for giving this opportunity.
Thank you so much, ma'am. So,
Thank you, ma'am. Thank you, ma'am.
okay, so we are moving for our next session, and I would like to invite Survi Gupta. Survi Gupta is a special educator as well as a speech therapist at Saksham Society, Delhi. She has earned her B.Ed Special Education in Hearing Impairment and Diploma in Hearing Language and Speech from Kalyanam Koti, Mathura. Her work experience includes consultant audiologist at Advanced Hearing for 2 years. She acted as a resource person in some programs. She has worked as a principal investigator in research papers, quality of life and a family burden between parents of children with intellectual disability from Mathura, UP.
Hello.
Yeah.
Audible?
Yes, yes. So I would like to invite you and hand over the mic, and please continue, ma'am. And one more thing, ma'am, will you share your PPT from your side, and could I share?
Ma'am, no, I'm not going to share. Yes,
Okay.
ma'am. You carry on. Yes,
Okay, okay. Just give me a moment, ma'am. Okay, so is it visible, ma'am?
yes, ma'am. Okay. Thank you, ma'am. Hello, everyone. Good evening. Firstly, I want to thank Saksham Society for giving me this opportunity. And today we are together to celebrate World Autism Awareness Day. And I want this session be an interactive session. So if you have any query if you have any query or question, please keep with yourself and you can ask after the session. So this is autism spectrum disorder. Because this is an awareness session, so we will start with the basic things. What is autism? What is the symptoms of autism? And we will proceed slowly. What is the effect of autism? Okay, so autism spectrum disorder is, in Hindi we call it is swalinta. Autism means self, a person who is lost within self, or hello.
Yes, please continue.
Okay, sorry, ma'am. Ma'am, please change the slide. Hello.
It is okay.
No, ma'am, change the slide, please.
Okay.
The third one.
Is it okay now?
Yes, ma'am. Fine.
Okay, okay.
So if we talk about the autism is a neurological developmental disorder, which means neurological is related to our brain. And development, if we talk about the development, it is like autism show its symptoms during the development of the kid. Okay, so autism show its symptoms within the 3 years of a kid. Okay, fine. So main areas which is affected by the autism is social interaction, communication, and the behavior. In social interaction, as we all know, smile is a social feature of a social interaction. So the kid who have autism or diagnosed with autism don't have social interaction with the peer group, with the environment. And if we talk about the communication, they are lack in communication. They don't communicate with others. They don't feel if if they have language, but they can't communicate with the other people. And if we talk about the behavior, they show repetitive and restricted behavior. It means if a child in a environment with a fixed setup, and he's continuously studying or playing in that area, and if you change the environment, if you change the room, they will show tantrum. They will cry because you change the setup of that area. So they are very restricted with their environment, with their area, and they show repetitive behavior like flapping their hands or something, tapping on a table. uh, and as I said, the symptoms generally appear in the first 2 years of the child. So ma'am, next slide please. Yes, if we talk about the attributes of autism spectrum disorder, uh, the kid who have autism, that kid show repetitive behavior and actions like flapping their hand, tapping on the table. And if he's watching somewhere, he's continuously watching there. Okay, unusual body movements and hand movements. And third one is great alteration in abilities. If you give any work to that kid, he can do it continuously. Okay, like if you give a toy to the kid, he can play with that thing to the whole day and repeat it, this his action to the other days also. He can need for similarities. They always try to sequence the things. And they will play with they play same game at the same place. They don't want to change their place. They don't want to change with their things. Unusual interest in object and restricted interest. They are very stubborn. They are very stubborn with their activities. They don't want any change in their environment. Unusual emotional reaction and expression. It means they show unusual emotion, like they will start crying without any reason. They start screaming, they start laughing without any reason. You can't find any reason why they are crying, why they are smiling. Or they have sensory issues also, like hearing. uh, if we let's take example. If I have a kid, it's it is very I want to say, it's depends person to person. Symptoms of autism vary person to person. Okay, like if a kid in front of you and I start playing drum, they will show. If he have sensory issue of hearing, he cover his ear with his hand and start going there and there. And people with autism show social interaction issues. They don't interact with others. They don't smile. They don't greet. uh, Ma'am, please change slide. Next slide please.
Actually, it's taking too much time from my side. I already done.
Okay, ma'am. If we talk about autism, there are of 4 types. First one is autistic disorder, second Asperger's syndrome, pervasive developmental disorder, and the fourth one is childhood disintegrated disorder. Ma'am, next slide, please. Autistic disorder shows symptoms like delay in language and also show communication challenges. People with autistic disorder, they they are delay in language, like if their age is 3, they develop language like a 1 year old kid, and they are very lack in communication challenge. They know the language if they have language within, but they don't know how to communicate with the other person. If someone asks something, they don't know how to give the answer to. So many in autism we also show imitation, we also see imitation and echolalia, because they don't know how to answer the question, how to communicate with the other person. And this is also see that people with autistic autistic disorder have intellectual disability also. Next one is Asperger syndrome. In this disorder, there are milder symptoms of autistic disorder. In this, people show social challenge and unusual behavior, or and in this, intellectual disability are not found in autistic kid. But as I said, in autistic disorder, we also see intellectual disability. But in Asperger syndrome, we don't see intellectual disability. If we talk about the pervasive developmental disorder, there is no specific reason, like as as I talk about the autistic and Asperger, we have some criteria, but in pervasive developmental disorder, we don't have any criteria that what is the thing which seen in a kid. So in this, there can be symptoms can be vary. Uh, it can have autistic disorder also milder, as well as Asperger syndrome. So it's very person to person with some milder symptoms. If we talk about childhood disintegrated disorder, in this child, this is very rare syndrome. This is very rare to find out in our society, and people are very lack in communication and social skills, and this is very extremely disorder find in our society. And there are many thoughts about this disorder. If we talk about the diagnosis and assessment of ASD, there is no specific diagnosis of autism. We use, or psychologists use some tools to diagnose the autism, and there is no specific, because this is not a blood test or something else. So this is a dysfunctioning of brain or something disorder in brain, so we can't diagnose in a medical term. But there are some psychological tests. We can find out the label of the kid in autism, like MCHAT, the modified checklist for autism in toddler. CARS, mostly we psychologists or clinical therapists use these tools to find out the label of the kid in autism. And VSMS, Wind and Social Maturity Scales. If we talk about the how to treat autism, the only thing we can treat this is by therapy. So this is the thing how we start. Like, firstly, we start with the rapport building with the kid. You have the as I said, child kid lost in self. So firstly, we have to build rapport with the kid, be friendly with the kid, play with the kid. And after that, doing this day to day, after 5 days, uh, it's not fixed, it's very person to person. It can take 5 days, it can take 10 days, 20 days. If for one this is how we conduct a therapy. This is the report how we observe. First we observe the kid, what is the thing, what is the behavior of the kid. We write down what is the things his behavior show, repetitive, social, or communication delay in his behavior. Like we write down the things, like if the kid have poor eye contact, poor attention, we write down all the things in our observation report. After that, we make goal how to work on that kid. We write the areas which is affected by autism to the kid. Next slide please, ma'am. Like this, we write the areas like skill development. We make the goal what we want to see after 3 or 4 months in a kid, and we write the activities how we can achieve our goal, like candle activity. If we talk about the skill development, if we want to work on the attention and concentration of the child, then we will do some activities like candle activity, fevicol activity, coloring. And if we work on speech and language, these are some goals, and what kind of activities is required to achieve that goal are written here. uh, these are some points which keep in mind during the therapy. Be positive, because as we know, as society is also not aware about the autism, and parents are feel very panic about their kid. So be positive first. If you are not positive, you can't make someone positive. So you have to be positive about the kid, about the parents. uh, if you set some goals and kid achieve a little bit, you have to reinforce the kid, you have to motivate the child, so he can get motivated and do better next time. So always listen carefully to parents and counsel them in a positive manner. You have to also build rapport to the parents also, because they are the base. The kid is only for 45 minutes with yourself, but the whole day parents are there for with the kid. So you have to listen them carefully, what they have within about the child, what they have at home, and you have to motivate them about the about the kid, that he can do better if they support them. And yes, keep change the as I said, they have repetitive and restricted behavior and with the environment also. So you just keep change the place for therapy, so they can get familiar with the environment, with the changing environment. And you and this is a progressive report. uh, First, when the child come to your clinic, you make observation report, what you have seen in the kid, you make goal. After 3 or 4 months, you make progressive report, what is the change after the therapy the child get within self. So this is a progressive report. The first child, if the child came, if he has not attention or poor eye contact, what is the result after the therapy, after the 3 4 months, you have to write in progressive report. Like if he do not if he do not have attention and concentration. Thank you everyone. Thank you, ma'am.
Thank you, Surbi Gupta ji. And this session is now open for a question answer session. And I already shared the next meeting link in the chat box. So after 6:20, you can rejoin the session again. If you have any query, so you can ask directly to our speakers and clear your confusion.
Ma'am, I have a doubt actually. Can I ask a question? Surabhi ma'am?
Sure, please, ma'am.
Yes, ma'am.
Ma'am, am I audible?
Yes, yes.
Yes, you are.
Ma'am, actually, my concern, my doubt is about is autism a hereditary issue? That means, like, is it inherited or it is being caused? Because what might be the reason behind this?
Ma'am, yes. Ma'am, actually, there is no reason find out what is the reason behind autism. This
Hmm.
this is the dysfunctioning of brain or something in brain. The actual reason is still not find out. What is the reason behind the autism?
Okay. Can a woman avoid a child being autistic when the baby is still in the womb? Can we avoid such conditions? It might be a
Uh,
condition with the people or the person who is bearing the child. It might be because of, as you said, since it's a problem with the improper brain development. What I mean to ask is, if a mother is consuming some sorts of good nutritious food which give a proper brain development, if at all she can follow this, will it be avoided or not?
Ma'am, because there is no reason find out behind autism, but yes,
Yes.
we can avoid this. Actually, we there is no reason actually, so we don't have
Okay.
what is the reason behind it. But yes, there
Okay.
are some medicine for the good development of brain. Doctor
Okay.
suggest to the pregnant
Hmm.
lady.
Okay.
So yes.
Okay. Thank you so much, ma'am. Thank you.
Anyone else? Any students? You can text also in the chat box if you don't want to ask directly. You can text here.
I think all the doubts are clear for the students because the speaker spoke very well, and I don't think so that our students will have any doubt, ma'am. Actually.
Yes, and I think we can close the session because we have 10 minutes also. So
Yes, ma'am.
I already shared the feedback link in the chat box, so you can fill the form. And I also
Sure,
share
sure.
a link of a blog, so you can visit there. There are lots
Sure,
of
sure.
information why we should celebrate the World Autism Day and what is the
Okay.
reason, and there are lots of information there, so you can also share with
Yes.
your students. And
Yes, ma'am.
the meeting is going to close, and I would like
Okay.
to thanks to all the speakers for such a nice and wonderful presentation, and I would request to the department and especially the HOD ma'am to continue this type of programs in the future also, because we are also working in a higher education field and creating so lots of awareness on various topics. So in the future we will
Ma'am,
continue.
sorry
Yes.
for the interruption, ma'am. Sorry to
Yes.
cut your word. Actually,
Yes.
one of our student is interested in giving her presentation.
Yeah.
If you
Okay.
give a
Okay.
chance to
Sir,
her,
I
she will
just
be able to.
I just forgot, and thanks for reminding me. So would it be better?
Thank you
Can we rejoin the session, our next session? Because
okay, ma'am. No issues. No issues. Because the session is about to close. Sumalaka,
yes,
ma, you can
yes.
continue in the next session, ma, because the session is about to close.
Sure. And
It
I'm
will be
so
an
sorry
introduction,
also,
actually.
and I am so sorry also because I
So,
just.
ma'am, actually, thank you so much for giving such a very nice platform to our students to speak about
Yes.
it's a biggest issue. Actually, most of the people don't know this autism do exist. Actually, even I was shocked about learning about most of the things. And thank you so much for giving such a wide platform to our students. Students, so ma'am, we'll meet in the next session.
Yes,
So
yes.
that she will continue and she will share her brief knowledge about the autism, whatever she has collected actually. Thank you so much, ma'am.
So I request to the Bhavani ma'am, please log in our next session so we can join
Sure,
there.
ma'am. Okay, ma'am. Give me a second. I'll do that. Thank you so much.
Okay. Thank you, ma'am. Thank you.